Welcome to Take on Health, a show by PubHealth TV. I'm Arion Lillard-Green, and today we're talking about something that doesn't get nearly enough attention: rare diseases. For many people, getting sick means a visit to the doctor, a diagnosis, and a treatment plan. But for those living with rare disease, the path is often much more complicated. Diagnosis can take years, treatment options are limited, and many patients feel overlooked by the medical system. One of these diseases is Fibrodysplasia Ossificans Progressiva, or FOP, one of the rarest and most disabling genetic conditions known to medicine. According to the International FOP Association, FOP causes bone to form in muscles, tendons, ligaments, and other connective tissues. FOP is often misdiagnosed, sometimes as cancer, because its symptoms can appear unexpectedly, often following minor injuries, viral illnesses, or even routine medical procedures. Today, I'm honored to be speaking with Storm Bush, who lives with FOP. We're going to talk about his journey, what it's like to navigate life with such a rare condition, the challenges of getting diagnosed, how he manages his health, and what real support and awareness mean for the rare disease community. This isn't just about statistics or medical definitions. It's about real experiences, real people, and what we can all do to be more informed and supportive. So let's hear Storm's take on health. Welcome to the show. I really appreciate you being here and sharing your story. So let's start with your journey. Living with FOP comes with its unique challenges, I'm sure. So, can you share a little about your story, when you were diagnosed, and how your condition progressed over the years, and how has it shaped your life?
I was diagnosed at the age of 3. Then doctors didn't know what was going on, and they were just confused on because they never seen a case like mine. So they tried to do surgery and trim a part of my collarbone off. Did surgeries on my back, and everything they tried never worked. And then when they gave up, they just said I would end up dying at the age of 13. I don't know. I just lived life and I didn't think about no age. After that, it was just a whirlwind of obstacles in life. Going to school, doing everything that everybody at school did. I was never in a disabled school. I lived a normal life, as some people say.
Did you know at age 13 they were saying you weren't going to make it past that age, or did your parents or family not share that
Oh,
information with you?
no, the doctors told me like when I was 8,
To your face?
and at a doctor's appointment. Yeah, it was at a doctor's
What?
appointment. It was like, oh, you're not going to make it because my condition would take over my body.
When your doctor said we don't expect you to live past 13, were you, for lack of better words, freaked out?
Actually, no,
Hmm.
because you really don't. It don't register what's being said as a kid. You just hear people just talking, not knowing, oh, I cannot be here no more. It didn't register me like that. It just registered. They just saying what they think that can happen, and
Mm.
that's what it was. I guess I was right because they were just talking.
We talked about age and who's older and who's younger before we started the recording. But since we talked about, your doctor saying at the age of 8 that they didn't expect you to live past 13, if I were a viewer, I would think, well, how old is he now? Do you mind telling? Or
I'm
you can give a
47.
range.
I'm
Okay.
47.
So you well surpassed
Oh
that
yeah.
expectations from the physicians. I read, and I didn't really want to say it out loud to you, but as
Oh, you can.
prepping for this conversation, 56 6 years of age, I believe, from
like the
the
average.
international FOP. Mhm.
Mhm.
Yeah.
Doctors say it's Stone's disease. I don't like when they say that, but realistically, that's what we turn into
Mm.
because the bone forms over bone and you won't be able to use it no more. I done had a lot of bone incidences where it'll just take over from my thigh bone to my pinky. I broke my pinky like in 2013, but I broke my arm in the fourth grade. And when I put a cast on, my arm stayed the shape of the cast. It never went straight out. When I had a bent cast, my arm stayed bent. So even when I broke my leg, it was like it healed the way it was formed. So I got a bent to my leg because how I broke it. And they never changed no bone back, so everything stayed the same. And then the pain of more you lose your jaw movement, that affects your eating. And then mine was like my jaw movement made me get lockjaw around 14.
Mm.
And from 14 to now, it was just my mouth got tighter, and then I was teeth grinding on teeth.
Mm.
And so I had to lose a lot of teeth the bad way because teeth be on top of teeth. When your jaws don't open, your teeth don't have nowhere to go. You just
Right.
start showing away your teeth and then
Jeez.
your gums. So it's besides the FOP pain, you dealing with gum pain, the loss of teeth pain. It's a lot.
Would it be
Like,
fair to say you live a life of pain, or are you just used to it and you get through the day?
you almost get used to it. It ain't no, my pain level is so high that what may hurt might not hurt, if it makes sense. Like,
Mhm.
I'm in pain, but you can't really do nothing about it, so you just be in pain. But I don't feel it as pain because I'm used to it.
Do you bother taking pain medication, or how
Mm,
is your condition
yeah,
managed with medications? Are medications effective? What does that look like?
medications help, but after so long, it's like if you don't take the medicine, then you're just gonna be more pain than you would be.
Mhm.
So it's almost like you gotta medicate yourself, but not so much, but you got to. Some people use medication, some people don't. Some people use marijuana, some people don't.
So have you had a good experience? Or physicians or other health professionals that you had a relationship with? Have you had that in all of your 47 years?
I had them before. Some of the doctors in, I'm gonna say from 2013 to 2016, like one doctor wanted to try to give me fentanyl. When fentanyl was like, they were trying to get people off of Percocets and on fentanyl, she was trying to get me on fentanyl real bad.
Really?
Yeah. She kept on saying, I think you'll appreciate fentanyl better than Percocets. And Percocets is addictive. Never said fentanyl was. She just said Percocets was addictive. But at that time, Dayton was going through an epidemic where people trying to sell fentanyl passed away. Just touching fentanyl, you passed away. I don't know. After
So,
the fentanyl incident, I was like, yeah, I gotta find somebody else. I gotta cut this like
did you feel like there was some shadiness in that?
I did, cause I thought they were trying to convert me to from Percocets to fentanyl.
Wow.
She gave me her first fentanyl that she gave me. I wouldn't even want to touch the box. I left that at the pharmacy. I ain't doing that. I ain't doing that. You ain't start me on some old new drug that y'all trying to get me to test out. I'm cool.
Well, it's
The other
good that
people
you
that enjoyed it, but I
yeah,
wasn't on trying a new drug.
yeah, it's good you have that indicator within yourself.
And she was saying like the fentanyl milligrams ain't that high, Storm. Like I need to get a hold of myself. I don't care if it was a two. No, I'm not taking no fentanyl.
Did you feel like she was trying to pressure you into that?
Oh yeah. Oh yeah. I ain't like her one bit after that incident.
Wow. Did marijuana help with pain, or was it just
Oh, it
something
helped.
that you like to do?
It helped. It was something I like to do. But when I stopped, I saw where the benefits was.
Mm.
So that's why I was like, I ain't gonna quit cold turkey, but I take it when it's needed.
And I
So
should probably throw in some sort of disclaimer that PubHealth TV, Storm, nor I are advocating to smoke marijuana to manage FOP or
no,
any other condition. We're just talking about his life experience.
exactly.
Have you ever talked to your physician about medical marijuana?
We had that conversation actually.
How'd that
And
go?
see, it's mixed reviews because one of them be like, you can't be on and smoke weed.
Mm.
But for somebody who don't do it, how can you say that? Like, you don't deal with the pain aspect and you don't deal with the benefit aspect of the Percocet or the marijuana. So it's like they're looking at it as it's not fit in their eyes, but they don't see the benefit
Have they
in my
ever
eye.
talked to you about any research to show benefit or not, or use of marijuana with the Percocets, or do you really think it was their personal opinion?
It was personal opinion because in the same breath, you can turn around and say, think you should get a medical marijuana card. And they sending me to the medical marijuana doctor.
You've never had a real relationship with a health provider. Is that fair to say or no?
Mind you, the doctors that's at these facilities are doctors that went to school. So
Mhm.
in 2 to 3 years, they're gonna be changing because they graduated. And somebody in my condition shouldn't be dealing with a school doctor.
Medical students.
Yeah, the medical students be because it's like you're meeting somebody new every year, every other year. And so you
Mm.
gotta tell this person everything about you every time you go to the doctor's appointment. Because mind you, I don't go to the doctor every 2 months. I see a doctor maybe twice a year because I personally don't like it because you don't know nothing about me and it ain't nothing to get to know because you about to be gone as soon as I met you. I commend you on the first part of your interview was when you was talking about it, you did your background work on it. The doctors are backing up or reading as they talking to.
Mm.
So they didn't really do no backup. They just reading what they looking at their computer and then walking into a room talking to me about it.
So it
Like
was
you
difficult.
had time, they didn't have time. Well, they had time, they just don't take the time.
It was difficult to get what we call continuity of care, meaning stick with one physician for a
Yeah,
while, for years. They know your condition. They can help manage your medications. Really know your body as best as they can without being you. I think it's important for medical students to be able to see patients with rare diseases. However, that there has been a point of contention that underserved or vulnerable populations are being overserved by medical students. But I can see how there was a lack of connection. Hey, you got to meet this guy, Storm. He's got a rare condition. There's 1 per 1 million people with this condition. Did you ever feel appreciated for that?
'Cause sometimes they make you feel like a dinosaur.
What advice or encouragement or messages would you share with other people?
Don't give up, cause you'll be mad how easy it was once you gave up. Cause and stuff, I'd be like, "Man, I can't do that," and then I actually go try it. It was that easy. Yes, I don't give up on that. If it's something I don't learn, I'm gonna figure it out. Just like
Like
that
that.
yeah, Imma figure that out, I'm telling you. Next time I see you, you gonna be like, "You done got me on camera, he figured it out." Imma figure it out.
Good
But
deal.
stuff like that, Imma figure stuff out. I just don't ever give up.
Yeah.
I keep a stiff upper lip.